Where would you be today without fertility? Not sitting in this room, that's for sure. Fertility issues affect 12% of the population, or 9 million people worldwide. Annually, couples spend $4 billion to combat fertility issues through the use of infertility clinics, fertility drugs, and surrogacy programs. Now, how does this tie into cows, you may ask? Well, just like humans, cows actually also experience fertility issues, about 40% of them, and dairy producers use similar tactics that human infertility services use to get their cows pregnant. My research goal is to find another tool to help create pregnancies, because pregnancies equals milk, and milk is a dairy producer's income. And anti-Mullerian hormone, or AMH, may just be that tool. AMH is produced by follicles on the ovary, which contain oocytes, the female gamete. It enters the bloodstream, and a blood sample can be pulled and analyzed with a hormone assay to determine blood level AMH, which is positively, directly correlated with the number of follicles that an animal has. To date, AMH has really only been used in humans and several other species as an indicator of the remaining follicular reserve, as well as the ability to produce numerous follicles at once. And while the latter is useful for dairy producers interested in embryo transfer, there's so much more that we can learn from this hormone if we study it further. What if a single AMH sample could tell us about a cow's lifetime fertility, how best to reproductively manage her, and her overall longevity in the herd? What if we knew what life events impacted fertility so that we could better identify them and remedy them more quickly? To test these theories, we are looking at 100 Holstein heifers. To test these theories, we're looking at 100 Holstein heifers, 13 to 15 months old, at the time before they're bred, tracking them through their first calving. We'll pull AMH throughout this period and monitor life events to determine their impact on AMH level. We're also looking at 300 lactating Holstein dairy cows and looking at their AMH levels 45 to 60 days post-calving. We'll be blocking these animals into two groups, a high AMH cow group and a low AMH cow group, and then half of each group will be assigned to one of two breeding protocols. One of these is an intensive program that utilizes fertility drugs, while the other is less intensive and breeds the cows when they naturally cycle. What we're hoping to find from this is that our heifers' AMH story it creates a storyline for us to know the lifetime events of that animal and how their impact is on her fertility. From our cows, we're expecting to see that our high AMH cows are more naturally fertile and benefit from being bred when they naturally cycle, while our low AMH cows are less fertile and benefit from being bred with fertility drugs. Ultimately, we hope that the producer can utilize AMH to identify lower fertility animals and create a more tailored fertility program with the hope that this can be transcribed into human medicine to solve human fertility issues. Thank you.